You hear about diabetes all the time, right? It affects millions of people. But what is it actually doing inside our bodies? It can sound really complicated, but honestly, it all boils down to one simple thing: a problem with how our body gets and uses energy. So in this explainer, we're going to break it all down, step by step: what it is, what to look for, and most importantly, what you can do about it. Let's jump in.
All right, so here's our roadmap. First, we're going to tackle the big question: what even is diabetes? Then we'll get into the main types, because they're not all the same. After that, we'll cover the warning signs and the serious risks, and we'll wrap up with the most powerful part: how we can manage and even prevent it. So let's get right to it. Section 1, what is diabetes? The best way to think about it is like an energy crisis that's happening inside your body 24/7. Let's use an analogy. Imagine every single cell in your body is like a locked house, and the energy from the food you eat, well, that's the delivery person standing at the door with a package of fuel. But to get that fuel inside, you need a key to unlock the door. So what happens if you don't have the key? Or what if the lock on the door is just broken? Well, that's basically diabetes in a nutshell. It's a condition where your body just can't handle its own blood sugar, which is also called glucose. And glucose is literally the main fuel that powers everything you do, from thinking to blinking. With diabetes, that fuel gets stuck outside the house, piling up in the bloodstream instead of getting into the cells that are desperate for it. So here's how it's supposed to work. It's actually a pretty elegant system. You eat something, your body breaks it down into glucose, and that signals your pancreas to release a hormone called insulin. And insulin, that's the key. It travels through your blood, finds the locks on your cells, and opens them right up so all that glucose can rush in and be used for energy. Simple and effective. But with diabetes, the system breaks down. The glucose can't get into the cells, so it just stays trapped in the blood, causing your blood sugar levels to go way up. And why? Because the key, that's insulin, is either missing because the pancreas isn't making it, or the key doesn't fit the lock anymore because the cells have started to ignore it. And here's the crazy part. Even with all this fuel floating around in the blood, the cells themselves are literally starving for energy. Okay, so that brings us to a super important point. Diabetes isn't just one disease. You got to think of it more like an umbrella term. To really get it, you need to know about the main types. Let's compare the big three. With type 1, the body's own immune system gets confused and attacks the part of the pancreas that makes insulin, so the key is just gone. With type 2, the problem is different. The body is still making insulin, but the cells aren't listening anymore. The locks are all jammed. Then you have gestational diabetes, which is basically a temporary version of type 2 that happens during pregnancy because of all the hormonal changes. And just look at these numbers. It's pretty staggering. Type 2 diabetes, it accounts for about 90% of all cases. 90%! This is so important because it means the type of diabetes that's most closely tied to lifestyle is by far the most common one out there. All right, on to section 3. So what happens when all that sugar is just stuck in the blood with nowhere to go? Well, the body starts sending out warning signs, and being able to recognize these and understand the long-term risks is absolutely crucial. You might have heard of some of these before. Things like being thirsty all the time or having to run to the bathroom constantly. That's your body in overdrive, trying to flush out all that extra sugar. And the exhaustion and extreme hunger? Well, that makes sense, right? Your cells are screaming for fuel, even though there's plenty of it just floating by in your blood. But here is a massive difference. With type 1 diabetes, the symptoms usually hit you like a ton of bricks. They come on fast and they are severe. With type 2, though, it's a completely different story. It's sneaky. The symptoms can develop so slowly over so many years that people don't even notice them. And all that time, the damage is being done silently. And that's exactly why this quote is so powerful. That silent threat is the real danger here. It's not just about feeling a bit off. Over time, that high blood sugar systematically poisons and damages your entire body. The number one casualty? Your cardiovascular system. All that excess sugar in your blood acts almost like shards of glass, scraping and damaging the delicate lining of your blood vessels. This makes them stiff, hard, and narrow, which sends the risk for heart attack and stroke through the roof. Your kidneys are also right in the line of fire. They're these amazing, super fine filters. But forcing them to filter blood that's thick and syrupy with sugar, day in and day out, it just wears them down. It clogs them up, and eventually it can lead to kidney failure.
And that damage doesn't stop there. It gets all the way down to the tiniest blood vessels and nerves in your body, like the ones in your eyes, which can lead to vision loss, or the ones in your feet, which can cause numbness and pain. It all comes back to that same root cause, sugar being trapped where it doesn't belong.
Okay, I know that all sounds pretty intense, but this brings us to our last and honestly most hopeful section, taking control. Because there is so much you can do to fight back against this. The game plan for each type is pretty different. For type 1, since the body isn't making the key at all, lifelong insulin therapy is absolutely essential. There's just no other way. But for type 2, the most powerful weapon in the arsenal is lifestyle change. Things like diet and exercise are the foundation. Sometimes medication is needed, but lifestyle always comes first. So when we talk about prevention, there's one thing to keep in mind. We can't prevent type 1 diabetes. It's an autoimmune condition. But that other type, the one that makes up 90% of all cases, we have an incredible amount of power to change that story. That's right. Type 2 diabetes can often be prevented, or at the very least, pushed off for years. And the steps to do it, well, they're not some big secret. It's the stuff we all know is good for us. Eating a healthy diet, moving our bodies regularly, keeping a healthy weight, and avoiding other big risks like smoking. These are incredibly powerful tools. At the end of the day, understanding diabetes is really about understanding how your own body works and the incredible impact your choices can have. It's a reminder that our health is a story that we're actively writing every single day. So the real question isn't just about managing a disease, it's what kind of story are you choosing to write for yourself? I hope this gave you a clearer picture of the whole topic.